Hey, welcome back. This is Dr. Jin Sung, and welcome back to the Dr. Jin Sung Show. Last week we had over 7,500 views on our video. It's been great. There's been a huge response in terms of patients sharing the information with other patients or other people who have thyroid conditions. So last week we talked about autoimmune thyroid or Hashimoto's thyroiditis. And we talked about how it's been misdiagnosed, or the fact that most medical practitioners will not actually test for it. So the simple test for that would be a TPO antibody or a TGB antibody testing, and that will help you determine if you have an autoimmune disease. In terms of thyroid health and how patients are taken care of, there are, I would say, mismanagement of thyroid conditions, because basically if you go to your medical doctor or endocrinologist and you see them for a issue, let's say you have fatigue, weight gain, hair loss, dry skin, nails are breaking, and so forth, what they do is they run your basic TSH number, which is your thyroid stimulating hormone. And based on that, they will tell you if you need a medication or not. Oftentimes they are lacking the other tests to help you really determine what's going on. So your primary doctor might run a TSH and a total T4 or a free T4. And if that's normal, you're normal. It doesn't explain why you have your fatigue, why you can't sleep well or you sleep too much, etc. So it really depends on what the physician is focusing on and what they're looking for. So in the traditional medical model, they are just looking for the TSH and whether you need a medication or not. So the thyroid management is very simple in the medical model. You get a medication, whether it's Synthroid, Levoxyl, levothyroxine, etc. What I'm going to tell you today is more specific testing that will help you determine how your thyroid condition can be managed. Okay? So the number one test for thyroid function is TSH, or thyroid stimulating hormone. That is a very important test and must be done for every patient who have symptoms of thyroid conditions. So that's actually a brain hormone. So going back to your basic physiology, your hypothalamus produces a hormone called thyroid releasing hormone, and then your pituitary will release thyroid stimulating hormone. So TSH, or thyroid stimulating hormone, is actually a brain hormone because it's produced in the pituitary gland. That goes to the thyroid, and the thyroid will produce the hormones necessary for your basic function. Okay? So TSH is a very important number. Okay? The other number they should run is a total T4, a total T3. So if you go back to last week's video, total T4 is basically your inactive hormone, and total T3 is your active hormone. T4 needs to be converted to T3, and it occurs primarily in the liver and your GI tract. Okay? So total T4, total T3. The next thing they should check is a free T4 and a free T3. Okay? Free meaning that is the unbound hormone that actually has a physiological effect on your cells. Remember, every cell in your body has receptors for thyroid hormone. So going back, you need TSH, total T4, free T4, total T3, free T3, okay? And then you're going to need markers like reverse T3, okay? Because reverse T3 can be a very important marker, because reverse T3 is not a usable form. So it kind of tells you if your reverse T3 is elevated, you're not using your total T3 or free T3 hormone. Okay? The other important marker would be T3 uptake. T3 uptake is inversely related to thyroid bonding globulin, and what affects this number primarily for most women is hormone replacement therapy. So people who are on estrogen replacement, or they go into menopause early and they go on estrogen replacement, it can really throw off your thyroid hormone or the active forms of hormone in your body. So those are all important numbers. And the final two markers that are very important is obviously the number one cause, Hashimoto's thyroiditis, is TPO and TGB antibodies. So those tests need to be done in order to thoroughly evaluate your thyroid condition. So the main problem with this is that when you look at that, you need to be able to interpret the lab results. So if you just have TSH and you have total T4 and T3 and that's it, then it's hard to interpret the exact cause. So the person who comes in and they have all these conditions despite taking a medication, then you need to run these other numbers in order to figure out what's going on with them. Okay? So the number one cause again is Hashimoto's thyroiditis. And if you take a medication for it and you do not feel well regardless of the medication, then you need to dig deeper. And that's what we do in this office. We like to go and dig deep and try to find the root cause. So when you do a blood panel, we usually will do all your thyroid hormones, and then we'll look for inflammatory markers, something called CRP, which is C-reactive protein. We use a high sensitivity CRP, and to look at the ranges to see if there's inflammation going on. So global inflammation or general inflammation tells us that there's something going on that's causing inflammation. Okay? That number can be from 0 to 3 based on your regular lab. However, I like to see it below 1, which is really an indication that there's no inflammation if it's below 1. If it's close to 3, then you got to suspect that there might be a little bit of inflammation going on. So if we know we have inflammation, then we have to go searching as to what is causing the inflammation. And that is crucial. You have to find the cause of the inflammation. So cause of inflammation can be food reactions, parasites, it can be just stress, right? It can be traumas that cannot be resolved correctly. So it creates ongoing inflammation in your body. Okay? The other markers we like to check for is magnesium. Things like anemia is also very important. So you got to look for iron deficiency, along with another marker called ferritin. Ferritin is your storage iron, and that's really the true indication of whether you are iron deficient or not. So iron deficiency anemia is pretty common among the women who have Hashimoto's thyroiditis. And you have to make sure that iron levels are correct, because that can drive the Hashimoto's thyroiditis. The other thing you got to check is homocysteine. Homocysteine is a marker for basically B vitamins, B6, 9, and 12. This is very important because your B vitamins are necessary for stress management. It's important for nerve function. It's also important for methylation issues. So it's a very important marker, and homocysteine in itself is an independent marker for cardiovascular disease. So if you have high elevated homocysteine levels, then you are at a higher risk for a cardiovascular accident, stroke, and heart attack. Okay? So in our office, we will run a complete thyroid panel. We will look at your complete metabolic panel, along with your iron markers, inflammatory markers, homocysteine, etc. We also like to check vitamin D. Vitamin D is an important immune modulator, so we like to check that on every patient that comes in through the door. The other markers that we like to check outside of your basic blood panel is a stool analysis. I can't tell you how many patients I have that come in, really don't have any major GI symptoms, and we often find a parasitic infection. So we run a pretty comprehensive test called Diagnostic Solution, GI map test, which looks at the good bacteria, bad bacteria. It basically looks at the whole picture in terms of what the GI looks like. Okay? It also gives us a marker for inflammation, a small marker for gluten. It's a great panel. It's a very comprehensive panel. And oftentimes we run that, we find things, and we fix things there. You can also run things for leaky gut. Leaky gut is when your microvilli in your stomach become porous and large proteins can cross the barrier. So leaky gut syndrome is very common among Hashimoto's patients. The other test for like GI dysfunction might be a SIBO test, and this might be might be the first time you might be hearing about it. SIBO stands for small intestinal bowel overgrowth, and it's very, very common, and it's a leading cause for IBS. So a lot of people think who have IBS and they get the bloating, they go, I have IBS. But they may actually have something called SIBO, small intestinal bowel overgrowth. So we can also test for that. So we're looking at comprehensive blood panel, comprehensive stool analysis. SIBO is a breath test, which captures the gas of the bacterial overgrowth. The leaky gut test. We can also run something called an organic acid test, which looks at the physiological metabolites. And we can also run an adrenal panel or a hormone panel to see if these hormones are impacting the thyroid. People don't realize everything affects everything. It's not just one thing is affecting this one particular area. It's usually one thing is affecting a lot of different things, and in turn affecting more things. So you have to be able to narrow it down and do the proper testing. So I just named off a bunch of tests, but in reality, what determines what test you need is the consultation. We do an in-depth consultation. Everybody gets, on the first visit, a 75-minute consultation. Why? Because it takes time to figure out a patient. It's not a 15-minute visit or a 10-minute visit, and thank you, here's your vitamin, and you can go ahead and take this. It's not a quick fix. It's a journey, right? If you have Hashimoto's thyroiditis, you have to take a journey, and so you will feel better over time. It's not going to be I have the wonderful thyroid supplement here, and this is all you have to take, and you're good to go. It's not that. You have to be able to figure out the underlying triggers and then help correct that. And that correction takes time. So I think the traditional medical model, along with even alternative models, they get into trouble in the fact that it's always, I have a symptom and here's a medication. Or on the other natural medicine side is, I have a symptom, here's a supplement, right? Or I have a thyroid problem, here is Synthroid. I have a thyroid problem, here's a bioidentical hormone. Because bioidentical means it's better, right? It's bioidentical, it's natural. What if I told you, though, that bioidentical hormone can actually cause problems for people who have Hashimoto's, right? So you have to be very careful not to just chase symptoms with this medication or this vitamin. You have to be able to kind of understand the physiology, correct some of the underlying causes, then see what happens. Because if you do that, you'll have a cascading effect. If you do something where you, let's say, affect the GI tract, right? If you affect the GI tract, that might reduce food sensitivities, that might reduce inflammation, that might improve thyroid function. So it has a hormetic effect. If you do one thing, it has many effects. That's what we want. We want to be able to subtly change things, that it has a long-term effect, not just a quick fix. That's where we get in trouble, is because everybody's looking for the quick fix. Everybody's online. The attention span of most kids is like 2 minutes, right? And off to the next thing. You can't do that, right? With your health, you have to be able to be consistent and stay on track. I think that's very important. You have to be consistent in your care and stay on track. Otherwise, you're going to kind of, I'll try this for two weeks, and if it doesn't work, it doesn't work. It doesn't work that way, okay? So a thorough consultation is crucial to determine what type of test you need. So if you want to run these tests, we can run it for you, but we don't want to run 10 different tests trying to figure out someone. That's like a shotgun approach. We want to be able to say, based on all your symptomatology, your history, your travel history, your surgical history, your emotional trauma history. We want to be able to say, what tests do we need? So most patients who do come into our office, we end up running a full comprehensive blood panel and then maybe one or two other tests to see if we can help that patient regain their health. All right? So those are the tests that we look for. A comprehensive blood panel with all your thyroid markers, maybe a stool analysis, maybe a hormone panel that can run through saliva, or we can run it through blood. SIBO testing, or small intestinal bowel overgrowth testing. Sometimes we do a leaky gut test. Sometimes we'll do a gluten test because patients don't realize they have a gluten sensitivity, and it's hard for them to accept the fact that they can't eat bread anymore. And it becomes a very emotional thing for that patient. So we want to be able to run some gluten testing to make sure that we have an issue or not. So we can take patients off gluten because it might be a lifestyle change for them. It may be a forever thing for them. So it's very important to do those tests to figure out what's going on with you. All right? So before I end, I just want to talk about lab ranges. If you look at lab ranges, it's very broad. So since we're talking about thyroid, let's look at TSH. If you look at the lab ranges, okay, it goes from about 0.5 all the way up to 4.5. So if you're 0.5 all the way up to 4.5, you're considered normal within the medical community. There's nothing wrong, right? But what if you were, let's say, 4, and you have all these raging symptoms of hypothyroid? Your hair's falling out, your a third of your eyebrow is falling off, your skin is dry, your hands are cold, I'm constipated, right? Then we have to assume that there's a problem there, right? What we do for TSH is we narrow that range and we say, what is an optimal range for a healthy individual? And that typically will fall between 1.5, 1.8, up to about 3. Okay? That would be a healthy range. Now sometimes if you're on a medication, it may go below 1, and because you're medicated, that's okay. But it has to be monitored. So what I'm basically telling you is, if you look at the functional ranges for a lot of this blood testing, it's important to be in the functional range and not just in the lab ranges. Because the lab ranges tell us pathology. Functional ranges tells us physiology and optimal health. And that's what we're looking for. We're looking for optimal health. So the functional ranges are very important to help determine the course of care for a lot of patients. And a lot of doctors don't do that because it's easier to just look at the lab and just say, hey, you're fine. I don't see anything out of range here. Okay? But if you plug it in and you do the functional ranges, you can tease out a lot of little problems, and you help those patients by helping those little problems, and then their health suddenly blossoms and they feel much, much better. Okay? I'd like to thank all the people who are viewing the video, and I really do appreciate everything, all the comments that I've had. This is live. I'm not a person who can speak very fluently on camera, but I want to get the information out there. What I'll do is I'll list the thyroid tests below the video, so you have that for your records, okay? And thanks, and we'll see you next Tuesday at 12:30, and we'll give you more information that's relevant for your health. Have a great day.